related to, I think, cough complaints, and I think I have talked a lot about the cough complaints, the recurrent cough and cold, and how does cough, manifest in the form of differing from patient to patient. Sometimes the patient coughs with pain in the chest, with pain in the throat, at the rawness of the throat, and then stitching pain in the throat. We have dealt lots in the cough. If you have any questions, you can always ask me. But let us move forward with another disease that has been, I've been treating that disease for a long time, but there were a lot of questions in relation to that complaint because the disease which I'm talking about is diabetes mellitus. So a lot of people ask me how to see the symptoms in diabetes and how to understand first on the first hand, depending on the local symptoms, depending on the symptoms, what the patient comes for. For example, if there is high diabetes mellitus, so then you know the patient may have excessive thirst, frequent urination, fatigue, and other symptoms of diabetes, weakness and all. So there are some homeopathy remedies which are very, very commonly used. In fact, if a patient comes to us, he always comes and says, "Sir, I have diabetes mellitus and I'm already taking cesium jumbolinum." The patients tell that way. Good afternoon, Dr. Vishaka, Dr. Smita. Now, don't give blindly cesium jumbolinum or XYZ remedy. Let us first differentiate what are the symptoms of cesium jumbolinum which you should see in the patient. Dr. Babel, hello. So I'm just trying to tell you some acute symptoms on how to prescribe. Don't prescribe blindly cesium jumbolinum or cephalendra or uranium nitricum or phosphoric acid or lactic acid just because they're good for diabetes. When you are prescribing cesium jumbolinum, good afternoon, Dr. Navjot, make sure that cesium jumbolinum helps to reduce the blood sugar when the patient suffers from excessive thirst and urination. And one of the very important symptom of cesium jumbolinum is that the patient suffers from itching rash, especially on the chest. These are the very, very important indication of cesium jumbolinum. I hope you are understanding that. Next, it is cephalendra. Now, cephalendra indica, in India, we eat some vegetable that is called kundru. That is cephalendra indica. So, whenever the patient comes of diabetes, tell him to eat kundru. It's a vegetable and you can eat once a week, twice a week, which gives very good results. In cephalendra, the most important symptom to see for is there is burning sensation and there is weakness. There is burning sensation and there is weakness. So, it could be used where the patient of diabetes suffers from burning in the soles, burning of the palms. In that case, cephalendra is useful. Now, you can go home and read these remedies in detail, but these are the symptoms which I have seen in a snapshot prescribing. For example, uranium nitricum. Now, uranium nitricum is a very interesting remedy whenever the diabetes is with weight loss. The patient comes and tells you, "Sir, since 4 or 5 months, I was reducing weight. My rate was getting lowered. I was 60 and now I'm 54 or 53. So I checked my sugars. The sugars were very high." That is a very important indication of uranium nitricum. So there is excessive hunger and fatigue and weight loss. That is uranium nitricum. Hello, are you with me? If you have any questions, you can definitely ask me the questions. Otherwise, I keep on telling the mater medica and half an hour is finished, and then a lot of people contact me and say, "Sir, my question was not answered and I wanted to ask this question." So if you have any questions, you can simultaneously ask me the questions. When I finish my thought of diabetes mellitus, I will go in and answer your queries. Next remedy, which is again very, I would say you abused in homeopathy for diabetes, is phosphoric acid. Whenever we get complaints, patient with diabetes, if nothing works, we start phosphoric acid. Phosphoric acid has a very important indication, and that is apathy. There is a lot of apathy in the patient. There is a lot of mental exhaustion. that is a very important indication of phosphoric acid, mental exhaustion, and that you will see in the patient of diabetes mellitus in case if the patient is phosphoric acid. If you have, if you have seen a phosphoric acid patient, uh, if you open Allen's keynote, just open Allen's keynote, read the first line, phosphoric acid. It is written beautifully. We only remember, that elements or loss of vital fluids. It is there, but you have to go one step ahead. That is, persons who were originally strong constitution and now have been debilitated by one of the causes vital fluids, but debilitated by long succession of moral emotion as grief, care, and disappointment. This is phosphoric acid. I'll just take one question first. Hello sir, voice female जैसी रहती है face पर. Yeah. So this is a question of a person of Mr. Khan that says that the voice is like female and other symptoms. So you can write down some remedies which are very, very important. First is pulsatilla, second is cilicia, third is lycopodium, and fourth is calcarea. Sir, kindly tell some medicines for drowsiness, feeling throughout the day. Difference between gelsemium and nux moscata. See, there has to be a cause for drowsiness. I think this question was asked in the previous YouTube also. There has to be some cause of drowsiness. Unless you get the cause, how can you treat the case? No, there has to be cause something, maybe some stress is there, financial stress is there, career stress is there, work stress is there. Try to find out the cause, and then if it is accompanying symptom drowsiness, then you can think about the remedies. So let us go forward. One also remedy which normally people say they use lot of time, that is lactic acid. Now as you have seen, phosphoric acid for mental exhaustion, for weakness after stress or apathy, long continued moral affections, grief, care, disappointment, that is phosphoric acid. Now lactic acid. In lactic acid, one symptom is very, very important, that is sore belching. There is lot of sore belching. The patient of diabetes comes in front of you and starts eructation. Says, Doctor Sahab, since I have got diabetes, I am feeling very acidity. Too much acidity, lot of belching. Don't give always carbohydrate, nux vomica and lycopodium. Those are there. But in diabetes, sore belching and dryness of mouth. Dryness of mouth is definitely a very common symptom of diabetes, but in lactic acid, dryness of mouth, sore belching, intense thirst. Because if there is dryness of mouth, intense thirst is there, and nausea. So everything related to lactic acid accumulation in the body, stomach is involved first in lactic acid, and then you can give the patient lactic acid. Okay, if possible, if you have given LM potency. Drowsiness throughout the day, we have just done it. Okay, so whenever you find that your question is answered, just tell me something. Just tell me something that you have understood and give me some, so I know that you are understanding what I want to tell you. Kindly tell some medicine for ED due to stress. ED due to stress, just take out the stress and ED will be okay. There is no specific medicine for that. As we go further, now one remedy which is in homeopathy, lot of people I have seen using is insulin. It is not that insulin which we give in allopathy medicine. You start insulin 200, 1M, 6, 30, and the patient is better. No, it will not happen. Insulin has a specific action. First, it can be used as an intercurrent if you feel that your remedy is right in diabetes mellitus, but it is not working. Give him a dose of insulin 200 intermittently, and the patient would be better. Second, in cases of type 2 diabetes mellitus where there is insulin resistance, or for example, the patient has no diabetes, but on the pathology report, the serum insulin is very high. That means the patient is suffering from insulin resistance. In that case also, infrequent dose of insulin 200 would help. Third, in case of obesity also, if you are treating a case of obesity and because of that the symptoms are there and your remedy you feel is right but not working, in that case also you can give insulin 200. Or in case of acanthosis or family history of diabetes, the patient comes to you for treatment, for other treatment, but you feel that the remedy which you have given is not working, you can open up the case with a single dose of insulin 200. Hello, are you with me? Everyone, yes or no? Sir, patient 80 years having patchy homogeneous opacity in right median lower lungs, consultation shifted towards right. No, in this case it is very important. Same patient having atherosclerosis. Okay, so in this case, Navjot, first of all, important is that, of course, in this type of case, I would really like the case should be good. But then, in your case, you can think about three remedies which come to my mind. Is first is phosphorus, second is Kalicar, third is Terra metallicum, and fourth you can think about Chilidonium. Of course, symptoms have to be there more. Yes, so I think everybody is understanding it. And now these are the basic remedies of diabetes, which is symptom like dry thirst, dry mouth, intense thirst, nausea, belching, weakness, fatigue. In general, I have told you 4 or 5 medicines. If you go deeper, then the patient with diabetes suffers from neuropathy. And sometimes the patient comes to us not for treating diabetes, but for the treatment of neuropathy, because they have taken a lot of tonics, lot of vitamin B12, D3, vitamin C, nothing is working. So the patient comes to us. So whenever there is diabetic neuropathy, you can think about phosphorus and arsenic album. Okay. Yeah, so breathlessness on going upstairs. You can think about Dr. Navjot. In this case, you do think about Arnica montana, think about sulfur, think about lacasis, and think about calibro. Second thing, next to neuropathy comes skin infection. This is a very common symptom in a diabetic patient: recurrent boil, recurrent pus formation, recurrent toe infection, recurrent fungal infection, recurrent boil. Then you must think about 2 remedies which I have found very useful in my practice. It is not a specific, but I have seen very good results. First is sulfur and second is Hiparsulf. Okay. Just a note to tell you that sometimes the patient comes with pus and sometimes he comes with open wound. In those cases, I have seen very good result with calendula external dressing. It gives you very good results. Apart from that, you can also use Echinacea angustifolia local application also. Take the mother tincture, about 5-6 drops, half cup water, stir it, and then you can dress the wound with calendula and Echinacea. It also gives very good results. Okay. And apart from this, in case of diabetes, make sure that the patient is on a low glycemic diet. There's regular walking, there's weight control, monitoring of blood pressure, and I have seen that whenever the patient eats raw food, especially before diet, this is called as, one term is very popular now, it is called as diet sequencing. So whenever you are eating, there has to be a diet sequencing. First take the raw food, then take the protein, and then take the carbs. So you can layer your stomach first with raw food, then with protein, and then with carb. So the digestion of carbohydrate is slow, so the sugar spike is less. When you start with dal chawal roti, immediately the food goes in and the sugar spike is high. So give a diet. The timing of what to eat is important. Raw food, protein, and then carbs. You will see that your glycemic index or your sugar spike is less after 2 hours, and the sugar will automatically come to normal. This is called as diet sequencing, which is very important. I have seen in my practice. Okay, so let us go forward. And something diabetes patient got recurrent UTI. Yes. It is means the patient, when he gets recurrent urinary tract infection in diabetes, you can think about 3 remedies. First is Apis mellifica, second is lactic acid, third is cantharis, and fourth is uranium nitricum. सर स्ट्रिंजी म्यूकस में काली बिच कॉकस कैक्टे कोरालियम दे चुका, राइट साइड माइग्रेन विद वॉमिटिंग रिलीफ, बट नो, नॉट एवरी टाइम. Now again, this is a very important question, and lot of time it happens that when we prescribe the remedies, and it does not work, and we were told in our college, thick ropey discharge very sticky, think about kali bichrome, think about coccus cacti, but it does not work. And then the problems start, what to do. So my dear friend, remember one thing: kali bichrome, coccus cacti are very important remedies. But there are other remedies also important in relation to Calibacrum and Coccus cacti, because whenever you are reading Mater Medica of whatever is taught in the college, that is a soric thinking, we know only one or two remedies. But whenever a patient comes to you, you must have at least 4 or 5 remedies to differentiate. If the repeat discharge is not matching Calibacrum or Coccus cacti, then what to give? So please write down the remedies. This was my problem also, maybe in early days of practice, that Calibacrum not working, so give 6, give 30, then 200, then 1m, then 10m, nothing works. So in relation to Calibacrum, Coccus cacti, do think about Seneca. Seneca is an interesting remedy. A Seneca patient is always better by bending the head backwards. This is Seneca. Third remedy, think about natrum sulph. Fourth remedy, think about Merck sol. And fifth remedy, think about lachesis. In your case, if there is vomiting also, you can think one more remedy which also has stringent discharge, ropey discharge, that is ipecac. Because in your case, the patient is suffering from vomiting also. Now just remember one thing. If the patient comes to you and says, sir, the discharge is ropey, stringy, mucus is there, but whenever I eat warm food, I feel better. Then my dear friend, think only about one remedy, and that is golden seal. Golden seal, normally golden seal I prescribe in 30 potency. If you are happy with the answer, please write down so that I can move forward fast. Gelsemium and drowsy, and see, drowsy, gelsemium is same. Heaviness of the body is heaviness of the eyes, cannot open the eyelid, the patient is very slow, the patient is thirstless, does not want to do anything, wants to sit in the room, in the bed, does not want to disturb anybody and sit down. These are very common symptoms of drowsiness, but I always tell you, find out the cause. Okay. Sir, in last Saturday class, I have discussed a case of patient having low sodium and potassium level with an IGF calculus. His BP got normal within few hours. Very nice, fantastic, very nice, Navjot, and congratulations that you are getting these type of cases. Very nice, very nice. And if you could, Navjot, tell us why did you give calculus? That would be very better for everybody to understand, because this was a very chronic case. Yeah, when the there is an imbalance in electrolyte, it becomes a chronic case, because if the potassium is sodium is less, then there is a lot of mental symptoms, disorientation. If the potassium is hampered, then there's a lot of arrhythmias, and it's an emergency situation. If you have controlled the BP by calculus, very nice, and congratulations. If you can write some symptoms, we'll also will learn. Wow, sir, you are great. This is HSP. That's why I am a big fan of you. Oh, thank you, Dr. Akil. And these mistakes I have done in my practice, my dear friend. These all mistakes I have done in my early practice, because we were also told ropey discharge, 10-day discharge, give Calibacrum. If it does not work, give Coccus cacti. So, this is from my mistakes you learn. So I have learned, I have been practicing. That's why, this comes. Now, one thing more, Dr. Akil, I would like to tell you something, differentiate between, now sometimes in cases of cough, the patient says that saliva, saliva is very thick. So differentiate between a thick saliva and a stingy mucus. Now, if the saliva is thick, then you definitely have Calibacrum, you have cocculus, but you don't have Coccus cacti. So in that case, think about arsenic, Nux mosquita, Rustox, Vithia, Crotalus cascavella, Califos. So thick saliva and stringy mucus, there's a difference. Why ED is common in diabetes? Medicine to cure it. ED is common in diabetes because the nerves are involved and nerve becomes very numb, and it's a weakness of the nerve. That's why there is ED. This is all you can get in your books of medicine. Don't waste your time and my time. Ask something about homeopathy, because I'll be interested in telling you some symptoms. If you give in your OPD, if you give in your clinic and you get results, so I'm happy that I am actually not wasting my time. Otherwise, just telling something what is written in medicine in very flowery language becomes a very good lecture, but actually in practice you don't get good results. So ask something more clinical. So let us go forward. Dr. Navjot has got a good results for blood pressure. Nice. Dr. Keel, I hope you understood something about of the stringy discharge. So let us go forward. So when the expectoration is stringy, it is thick, you can think about this remedy. Now, sometimes the expectoration, doctor. If there are no questions, there's a question. Okay, a 29-year-old lady, 95 kgs, she couldn't find a change after practicing dieting and gym. Had surgery twice for hydrocephalus. Okay. Now, see, if the patient is suffering from hydrocephalus and not getting relaxed with surgery, twice she has done, still not, then you have to take the whole case and you have to ask the question to yourself, why? Why is the body behaving in such a way that it is, in spite of so many crude, you can say, so many unnatural treatments, still the body is coming back and back and back. That means the patient is mentally very, very obstinate or very, very rebellious. If you can find that in your case, very nice. Don't try to fit my rubrics. If it is there in the case, then you can enter the case through this rubric. This is understanding the language of the body through the language of mind. Okay. Emaciation of the body, able to walk straight, that is quite normal. That's because of the stiffness of the joints. There are a lot of remedies. First try to take out the cause, why, and then you can go forward. Okay, so I hope you understood something about this. Okay, Dr. Marina Ima, wow. Okay, so this surgery case, hydrocephalus, is a very interesting case. I would be very happy if you give a good follow-up in this case, and you can understand why the body is behaving in such a way. So understand what is the body trying to tell you. This is important. If the body is trying to tell you that I don't want to get cured, I want hydrocephalus, it's coming back and back and back. So it is the mental nature of the patient. That's why the body is behaving in such a way. So ask yourself why, and then you can get the answer from the patient. Okay, thank you, and be in touch with this patient. So we also should know that whether homeopathy has worked in that case also. I had a very interesting case, few cases of hydrocephalus which were cured with homeopathy, not treated, cured. We could, the operation was not needed, and those are very good cases. They are still follow up with me. Quite often my son suffers from mucus and cold. In this case, Dr. Vohra makes sure that to take a case because it becomes a constitutional case. The body is not able to fight the infection, the immunity is low. You can think about some polycrust remedies like calcarea carb, like sorinum, like Merxol, Lycopodium, Thuja, Belladonna, which can give you good results if the case is taken properly. Sir, patient say I am better even in ICU because he thought not to disturb others. Time passes quickly. Very nice. I think this is cocculus, I think, Navjot. Very nicely written, and very nice you took the case for the case taking, Today only I got a good results of a case of infertility. She was a MBBS doctor, a gynecologist, and she could not conceive for years, I think 8 to 10 years. And today only I got the WhatsApp message that now she's pregnant. So understanding case taking through the language of the patient, through the language of the reports, through the language of the associates becomes very, very important part in the case taking. In fact, sometimes the most important part in case taking, because how is the patient behaving and what is the change in the patient's behavior from normal or from routine, only an associated can tell you. That's why it is an important symptom. किसी को कोई फर्क नहीं पड़ता. Very nice. See, very nice, very nice, very nice, Dr. Navjot. You have that's what I tell my students also. Whatever I tell you is basically coming because the patient has told me this symptom. So whenever I'm explaining to my fellow doctors with me, it is the language of the patient which I'm telling you. What is written in books, I cannot guarantee it's written on that, but language of the patient converting into a rubric form or converting into a language of the mater medica and then prescribing is an art. Okay, very nice, Dr. Navjot. Medicines to increase motility of see, this is a very absurd questions. I don't deal in specifics. So when you ask something ask relevant so that the time is not wasted. When we can when we can prescription of polycrest. Whatever I can understand, Dr. Asutosh, is that polycrest are prescribed when you take the whole case and it is matching your case with the miasms, then the polycrest are important. It is not always that the polycrest would cure whatever comes in your repertory chart. For example, belladonna is normally thought to be acute, but there are a lot of cases in my practice which I have treated and cured chronic cases with belladonna also. Whenever you can ask to my assistants who are there, if you know them, you can always ask them how is my practice and how are the results. They will be able to tell you better. Bending head backwards get emulsion means Senega, which potency, sir, 6 or 30. Normally, Dr. Akil, I start with 30 potency only. What Hahnemann has told. Of late, if you have an LM potency, much better you can repeat, and that would give you good results also. Senega. Patient having chest infection filled with mucus with rattling sound, mucus is yellowish and thick, comes out on coughing. I think this is an open question that a lot of people would be able to answer. First of all, see, whenever the expectoration is yellowish, if you go in the mater medica or you go in the repertory, there are a lot of medicine, because either expectoration can be white, it can be yellow, and then turns to green. So whenever the expectoration is yellow, then you can always go in the repertory in lemon colored and which type saffron colored. I don't go into so much details. Yellow expectoration, in my mind there are 4 or 5 remedies. First is of course pulsatilla, second is hydrangea, third is phosphorus, fourth is hippar, fifth is calcarea carp or calcarea sulf also you can think about it. And then if you can think when is the cough more, in the morning, while waking, in the afternoon, or at the night, then you can differentiate. For example, it comes easy. So if it comes very easily, these are the remedies you can think about what I have told you. Pulsatilla also, it comes out easily. Phosphorus is there, hippar is there, calcarea is there, calcarea sulf is also there, hydrangea is also there. Especially if the patient comes and tells you, especially it is in the morning, then think about phosphorus, pulsatilla, silicea. Very, very important remedies. Jaldi aapse milunga. Okay. Some doctor wants to meet me. Could you please tell something about LM potency? If I think a lot of doctors have heard my lecture on LM potency, it is there on the YouTube, which I have taken an exhaustive lecture on LM potency, which I feel that I have really made a great effort on making that potency. So potency chart and potency slides. You can go on my YouTube. There will be some videos of LM potency, and you can get the detailed knowledge on that. Okay. Sir, calculus fit because he's telling किसी से फर्क नहीं पड़ता. Wow, so fantastic. Thank you so much, Dr. Akil. Yeah, this everybody can become a good doctor. You can keep following the language of the patient and convert it into rubric form. It is not always one remedy calculus. There are other remedies also, but gradually once you start learning, you start getting interest, and when you start getting interest, you start opening the repertory. When you start opening the repertory, you get a lot of rubrics in relation to that. Okay. So let us go forward. Again, there are some questions, scrolled up, so you can always write. So, thick ropey expector. Just one thing I would just add, Dr. Nojot. Sometimes the patient comes and tells us that the expectoration is easy, nothing works, and the patient is very weak. In that case, if sternum metallicum fails, or you feel if the patient is of sternum metallicum because you cannot expectorate, the chest is weak. In those cases, I have found oleum jack, that is cod liver oil, works wonderfully. In sternum mate, if the chest is weak, difficult to expectorate because he cannot cough, sternum mate, if does not work in your case, try to give the patient oleum jack. Oleum jack is basically prepared from cod liver oil, a remedy for weakness. And then the cough does not come out, it is basically oleum jack. Okay. So this remedy was infrequently used, but sometimes, if our remedies fail, then you have to study and again go to mater medica and understand why did it fail first, and second, what remedy to prescribe. Oleum jack. Please remember this remedy you can give. So I hope all questions are answered properly, and it's already half an hour up. So I hope, thank you for joining me, and I hope you enjoyed as much as I enjoy sharing knowledge with you. Thank you until next Saturday. Goodbye.